In terms of the age that you should be to get a hair transplant, there is no like one, number for this. In general, I like for my patients to be able to legally consent for surgery. So I'll rarely operate on anyone under 18, but that is a very young age to do a hair transplant. There are some reasons for why we might do a hair transplant in late teenage years or, early 20s, and there has to be sufficient hair loss. There has to be enough donor supply, and patients need to be on finasteride for enough time to make sure there's good stability. You have to be really careful with the types of cases you take on at that age and how the hairline is designed, because there's of course a lot more potential and many more years of hair loss. If you invest tons of grafts into a low hairline, that might come back to bite you later on. So that is really on the minimum age side. And then the average age for someone getting a hair transplant, at least in my practice, is like usually mid to late 30s. And that's not because that's exactly what I look for, but that's like roughly the time when people start to reach out for hair restoration help. They may have a nice steady job by then, and enough hair loss has occurred where they're looking to potentially augment and improve their hair situation. And then in terms of like the maximum age, well, if there's enough hair loss and still good donor hair and good hair stability, and if the person is still healthy enough to undergo a procedure, then we can do it. So there's no like age limit per se, but there does come a point where people, don't care about their hair as much. So I've maybe operated on someone up to early 70s, but I don't think anyone beyond that. But again, if there's good hair stability, good donor supply, a very clear area that can be transplanted, and good overall health, then it's overall safe to proceed to surgery.